Welcome to this series I'm simply going to call Sciencing, intended to help you to be able to read, understand, and critically interpret scientific research. In this module, we're going to look at the concepts of blinding, sometimes called masking, but almost these days always called blinding, and allocation concealment. These are most commonly used in the context of randomized controlled trials, so if you haven't watched the module on those, please do so. You'll see the link up above. If you're good, continue. Blinding refers to ensuring that one or more people involved in a study are unaware of which participants received which intervention, and that can be the participants themselves. And this is often a part of the design of randomized controlled trials. But some types of blinding can be used with other experimental study designs as well, and indeed even some observational studies. The purpose of blinding is to avoid bias, specifically to avoid knowledge of who is getting which intervention or which treatment, influencing the outcome of a study. We'll look at how knowing who received what might influence study outcomes as we look at who might be blinded. Participants may be intentionally kept unaware of what intervention they are receiving to avoid the placebo and nocebo effects that are covered in another module. So again, worth having a look. Participant blinding might be achieved by having a placebo, pill or capsule for medication and dietary supplements, or a sham version of another intervention, say sham acupuncture for example, where needles are inserted but not in the appropriate places, or a sham surgery in which people are sedated and maybe relevant incisions made, but the key aspect of the surgery is not performed. The device is not implanted, or the bone spurs are not removed, or whatever it might be. It isn't always feasible to hide the intervention from participants, for example when comparing dietary approaches. However, it may be feasible to test the effects of modifying the fat content of, let's say, a milkshake without people knowing exactly what they're drinking. So always think about whether participants could have been made unaware of exactly what they are getting. And if they could have been, they probably should have been. Investigator or researcher blinding helps to prevent those delivering the interventions, for example, again, the tablets, etc., from consciously or unconsciously influencing participants in the way that affects study outcomes, let's say by setting expectations. This also works for our shake example, but not for the sham needling example, or the surgery example. However, in the case of the surgery, let's say, we could ensure that the surgeon doesn't talk to the participants after the surgery, and maybe doesn't even know which participants will get which intervention until the surgery is started or maybe even almost done. Evaluator blinding helps to prevent those assessing outcomes from being influenced by knowing who was given which intervention. For example, a pathologist grading change in disease score based on what they see under a microscope. They would not be told from which group the sample was, or whether it was collected before or after the intervention. This is so that expectation doesn't influence the more subjective aspects of their work. Another example comes from my own experience. Here, colleagues of mine were conducting a study looking at the benefits of exercise after stroke. You can see some of our wonderful participants here. In this study, we tested fitness, among other things, before and after exercise. Those of us doing the testing did not know whether the person on the bike was in the exercise group or the comparison stretching group. Again, so that we wouldn't be influenced when interpreting certain things that require a degree of judgment. And also so that we wouldn't potentially even inadvertently give different degrees of encouragement to the different groups. And that's because fitness tests are hard, and for many people pushing themselves physically doesn't come naturally. So some encouragement is needed in the later stages of the test. And of course, as I said, we didn't want to give more encouragement to one group based on maybe what we were expecting, because we might believe that a person who was in the exercise group would be fitter and would be able to push themselves harder. Another example is blinding of people doing the statistical analysis. Now, even though numbers can seem pretty objective, there are often results that are so far off the norm that it's easy to assume they are the result of some kind of error. In these cases, it's a judgment call as to whether to leave a result in the analysis or to discard it. If that extreme result is more consistent with the expectations for one intervention rather than the other, it's best not to know what group the participant was in. That brings us to allocation concealment. Allocation concealment refers to the person assigning participants to groups not knowing what the order of allocation is going to be, so that they cannot easily manipulate it. For example, 3 people might be enrolled in a study on the same day. If the person doing the group assignment knows which groups the next 3 people will go in, they might manipulate the order in which people are assigned. And they may not even be doing this with a view to cheat. They may have some other logic, and they may not even be aware that they are doing it. Now, if the sequence is concealed until each person is assigned, not much manipulation is possible, and certainly not any at the subconscious level. A key thing about allocation sequence is that it can be concealed even when blinding isn't feasible. So, when reading studies, even those using designs other than randomized controlled trials, but especially if they are claiming to be randomized controlled trials, some key questions to ask are, was blinding used? And if so, how was it achieved? This should be clearly described. And in whom? Also, was allocation sequence concealed? And if so, how? These should be clearly described, and if they're not, assume that they were not done. If you found this useful, please hit like and subscribe, and please continue watching other modules in the series to learn more. There is a lot to learn about research, and we don't go into every minor detail, or I don't, but over time I hope to cover a lot of the aspects. So maybe check out the video here, or the video here, or one of the others.